guys, Eric here with Move and Power Concierge Physical Therapy. Hey, March is here, and that means great weather here in Austin, Texas, and time to get outside and take full advantage of it. Now, to do that, you've got to have healthy knees, and that's why this month we're going to be talking about specifically the problems that we see with a lot of our patients in their knees. And there's like 4 main diagnoses that we usually see. That can be osteoarthritis, arthritic knees. It can be iliotibial band syndrome, meniscal problems, and also patellofemoral, or what we call runner's knee, okay? So we're gonna talk about that this month, and we're gonna talk about some of our favorite ways that we help folks out and such. And there's kind of one common theme that we see with all 4 of those diagnoses, and that common theme is that it's not always just the locally at the knee where the issue's at. There can be other factors kind of driving the problems. Those could be up in the hip, for instance, the muscles, the poor strength up there. It could also be down at the foot, where tightness in the ankle or overpronation could lead to issues. So the knee is in a precarious position where it's between those 2 joints, and problems above, up in the hip, or problems below can be a big driver for that. So that's one common theme we see for all 4 of those diagnoses. But let's talk about it. So with osteoarthritis, these folks typically can be in their 40s, 50s, 60s, and up. They're going to have pain generally on the sides, just general deep ache in the sides of the knee here. They're going to have pain probably in the morning. They're going to be stiffer, feel like, they just need to move it around to kind of warm up. And as they get moving, that pain and stiffness seems to abate. These folks are going to also notice discomfort after maybe sitting for a while or trying to get out of a vehicle, difficulty squatting, maybe difficulty getting down and putting the golf ball on the tee or getting it out of the hole after you make a putt. So again, this is something where physical therapy can be a huge problem solver for these folks. We've treated many people. They call us weekly saying, hey, I have a doctor here who's saying, it's time to do surgery, but I don't want surgery. And we help folks really stave off surgery and get back to their active lives and teach them how to keep that knee strong and sturdy so they can remain surgery-free yet active, okay? So the next common diagnosis we see is what we call patellofemoral syndrome, or like runner's knee. So this is a pain that's going to be more on the undersurface of the kneecap here, okay? So we've got the femur, the top bone here, the big tibia, the bottom bone, and then over here, the fibula. And that patella, the kneecap here, as you can see, it has a tendon up here, the quadriceps tendon and the patellar tendon, that allows it, that kind of moves it up and down through this groove right in here, okay? Think of that groove kind of like on your knuckle, and that kneecap needs to glide up and down through there, and it also has some mobility where it's going to spin a little bit as well. When you don't have that ideal movement, you can get some kind of compressive issues going on of the underside of that kneecap. And this can be driven from all the way back to when you're your teens or your 20s, depending on the type of sport you did, how much laxity or how flexible you are, or lack thereof, can be a big driver of the health and the mechanics of how well that kneecap's gliding. So again, a big driver of this, just like I said earlier, can be up here in the hip. And a lot of times we'll see that folks who have poor strength in their hip can really alter the mechanics of the muscles that connect to these tendons that operate this kneecap here. So getting those guys stronger and can lead to better mechanics of that kneecap. Also, we could look down at the foot. A foot that is a little unstable, maybe pronates a little much, can also change the mechanics down below, and again, make some altercations there. So definitely something that we see a lot and we can treat and help tremendously, okay? Next, meniscal injuries, meniscus tears. I can tell you about this because I've had them myself. And they can be not fun, but I'll tell you what, physical therapy helps, okay? So the meniscus, what are the menisci? So on this model here, the menisci are these blue shaped discs here, and they're kind of like C's, if you will. And they're gonna be between this big bone here and this big bone there. They're gonna help with some cushioning, but also some control, rotary control or stability the knee itself. So these folks, when they have pain or a meniscus is the main issue, are going to have pain with knee bending. They might even have some locking or giving way of the knee. The pain's typically on the sides here of the joint, and it can make squatting, stair climbing, just life in general, very difficult to do. But again, here's what we're finding out with the research is that physical therapy versus a meniscectomy, 2 years out, the physical therapy folks are at the same level as the folks who had the trimming out of the meniscus and such. Another good stat for you is that I took 100 people and we had an MRI machine out on the sidewalk, and of these 100 people, none of them had any knee pain or meniscal history or anything like that. 60% would show up with a meniscus problem, but they didn't have any pain. So what's that tell us? That even though you might have a meniscal tear, doesn't mean you can get around pain-free and moving like you want to. So they can be there, and the meniscus can be, have a tear in it, but it doesn't mean you have to have surgery. And that's where physical therapy can come in to educate you and educate you on the proper exercises to be doing to optimize the mechanics of the knee and nurture that meniscus so it can get back to doing its job and heal up, okay? And then finally, iliotibial band syndrome. So the IT band, you'll see this a lot in runners. Think of it as kind of a repetitive stress injury. And it creates think of it as a big band of tissue that starts here up in the hip, goes all the way down to the thigh, and then comes down here to the knee and has some insertion into the kneecap and into this area. Really, as that gets tighter, we'll call my fingers the IT band, it's going to create kind of a compressive moment over here on some of the sensitive structures there. And as it compresses and as you bend your knee with your running after each stride, you're going to get some irritation there, and it can get really irritated and really become very disabling, where running's very uncomfortable, squatting, and even just general walking can. So again, one of the drivers that we got to look at, the old hip there again. So as you can see, there's a common theme here. And that's where, with a specialist physical therapy and such, we're not going to just hone in right where the pain's at. We're going to take a look at the entire system there, from head to toe sometimes, and for sure, definitely looking from the waist down to make sure the mechanics are optimized and make sure we can make those sensitive structures down in the knee, make sure they're not getting overburdened with overworked and injury, okay? So I've got one exercise that a nice starter kit that if you're dealing with any of these, I think you should try to start. It's not a cure-all by any means, but it's a start to help kind of offloading the knee and bringing some improvement of your pain. So that's coming up right here. Okay, so the exercise that I want us to try is simply a side-lying hip raise or side-lying hip abduction, okay? So here's how we're gonna do it. We're gonna demo it for the left side, okay? So I'm gonna come down to the ground, have like a pillow ready, and I actually like to have a wall or a firm surface to slide my leg up. This is gonna help keep you honest and really target the area we want. So I'm gonna lie down here. I'm gonna bring myself nice and close to the wall here. I'm gonna have my back against the wall, and then simply, here's the start position. I'm gonna slide up the wall here, kind of keep the foot so it's pointed straight out or a little bit toe down, and you should immediately feel it right here on the top, kind of where the back pocket area of the muscle. Not over here, not on the inner thigh, but right here. Notice that I'm holding it up. I'm just gonna do a static hold here, and you're gonna feel an intense burn there, okay? Now, when folks start doing this, they tend to, the leg starts creeping forward a little bit. And that's why I like having the door here, because it really keeps you honest and really engages the correct muscles there. So after a 5 or 10 second count, you bring the leg back down, you can rest it. You could even, if it hurts to have if it bothers the knee to have the knee down like so, you could put a pillow in the between there and to kind of support and rest the knee. So again, we're gonna start here, we're gonna slide on up, keep that right there. I'm feeling it right here. Imagine there's like a bowl of water there. You don't want that bowl to fall off, so don't rotate your hip inward or rotate out too far, okay? So give this a go. I suggest working on five to 10 repetitions and starting with a 5-second hold, and then work your way up to a 10-second hold, okay? You're gonna feel a lot of work over here, but your knee will appreciate it. Give it a go and let us know what you think.